Hello, today I'll be performing the skill of a wound culture. I will make sure to follow all my GSPS protocols. I would make sure to abide my 11 patient rights, do my 3 medication checks and 2 patient identifiers, and assess for allergies. I would knock on the door, introduce myself to the patient, explain the procedure. I would ask the patient if they had any allergies. I would ask them to identify themselves using the 2 patient identifiers, their birthday, their name, and checking that against their wristband. As long as it all checks out, we're good to go. I would ask if the patient needs any pain medication. If no, then I can go ahead and start with my procedure. If yes, then I would check them R, see if they have any PR medications that they can take, or just any regular medications that they can take for pain. I would give them the prescribed medication, come back in an hour, 30 minutes to an hour to reassess the pain. If they're good, then we can go ahead and start. So first things first, I would perform hand hygiene. Put on, clean gloves. I would remove the old bandage using a push-pull method to loosen the tape, or I can use adhesive to help with any adhering if the bandage doesn't want to come off. And then I would pick the dirty bandage up from the center, making sure to taco the Band-Aid by looking at the type, the amount, the color, and the odor, or any drainage. Then I would dispose of the old bandage. I would also make sure to assess the wound, the same thing as I did with the old dressing, the amount, type, color, and odor, and the drainage. I would remove my gloves, perform hand hygiene again, put on a new set of gloves, I would get my package of sponges, opening them as needed. Then I would get my saline, my normal saline, and I would just drench these sponges all the way until they were wet. And then with 1 sponge at a time, take the sponge, clean, and then toss this one, get a new sponge, clean the outside, tossing that one, getting this last clean sponge, and do this side, toss that as well. And then I would just grab my new sponge, my dry sponges, open those with 1 sponge at a time. Do the same thing I did with cleaning, but this time just drying. Pat down the middle, dispose, pat down the edge, dispose, and then also pat down the last edge and dispose. Then I would discard these gloves, perform hand hygiene again, put on a new set of gloves, getting my wound culture package, my swabs, opening my swabs, unseal the sterile cap, dispose of that, making sure to pull out my swab without contaminating it, touching anything else, go into the middle and down, making sure not to touch any of the edges, Put it up, making sure not to contaminate it when I'm putting it in. Close. Remove my gloves. Perform hand hygiene. My swab, I would put the patient's name and birth date, today's date, the time, the location of the sample that I just took with my initials. I would send this to the lab, then I would report and record.